Welcome back to San Diego People. I'm Ross Becker. This week we're taking a look at healthcare in the United States and, of course, right here in the San Diego area. For many San Diegans, healthcare costs are too high, they can't afford coverage, or maybe they just aren't sure. And their only access to healthcare comes through community clinics. Well, here to tell us more about those clinics, and one in particular, Dao Doan, the Director of Business Development for Mountain Health. Dao, thanks for being here.
Yes, very nice to be here. Nice.
We were talking about the Affordable Care Act and getting into it,
right.
But that act has also done a lot for our community in terms of health care and for the clinics that are in our community. And I want you to tell me what it's meant to your organization and how you've then been able to reach out to more people and help more people stay healthy.
Right. I just wanted to touch base a little bit regarding Mountain Health organization. Since 1975, Mountain Health is a private, nonprofit community health clinic organization. We have been providing primary care to the rural community, especially in the Campo area, and also in San Diego communities, regardless of their ability to pay or not, because our mission is provide access to health care and also a well-being of a whole person.
But now with the Affordable Care Act, that has put more money into your organization. You've been able to expand even more, right?
Yes. Back in 2010, we realized that the Affordable Health Care Act will get access to uninsured people to have insurance. By preparation, we do have a program to assist patients coming into us, which we're providing services to regardless whether they pay or not. And some of those populations didn't have any health care services. So what we do, we have a program that would enroll them into a Cover California, as you touched base earlier. And also, the majority of those people that qualify for the Cover California would also be covered by the expansion of the Medicaid program. And last year, we serviced almost more than 1,000 uninsured patients into the Cover California, and 47% qualify for the Cover California, and 52% qualify for the expansion Medicaid program, which is very, very good.
Well, with the Affordable Care Act, with Covered California, there are more people that are looking for health care, and it sounds like you're there on the corner. You're there where that health care gets applied to those families. And now they have more options, don't they?
Exactly. And because healthcare reform, there's an expansion program that would help the local community health clinic expansion, and also building new clinic to provide services to the insured, the newly insured American, especially the needy in the community. What Mountain Health back in 2010 applied for a grant. Then we were awarded in 2012 to provide an expansion plan for our Campo area. Currently, our Campo area is only, our clinic is about 2,400 square feet. It's very small. We're servicing between 24 to 30 patients per day. Knowing the need in the rural community, our CEO, who is Judith Chaplin, her vision is to provide access to health care in that community. Then in 2012, when we awarded a $5 million to expand our services to build a 24,000 square feet medical clinic, which consists of primary care, dental, X-ray, and also behavioral care to the community in Campo, which is really needed. It has been a long waiting, as you know now, for the Mountain Empire Campo to get access to a hospital. It would take them more than an hour drive away to get there, so it is a needed. You
say it's really needed, and I can hear it in your voice, because I know you've seen patients that come in and go, I'm so glad you're here, because before we didn't have access to this, right?
Right. A lot of people coming in asking for services, and we were there to provide to them, but because the capability of such a small center, now we should be able to provide to the whole community with an array of different services, and that is what they need.
From Mountain Health, we can expand out. I mean, you're one of many in this country, community clinics. that provide this kind of care.
Yes.
What has the Affordable Care Act meant in general to community health care like this? Is it something that you see as the future of health care, that one-on-one attention in the neighborhoods as opposed to large hospital settings?
Yes, definitely. Many people in San Diego only get access to their local community health clinic. Especially in the minority communities, the lack of language capability and also lack of the cultural awareness of how healthcare practices in these communities. With the healthcare expansion program, we are able to go into and build a new center or maybe access a center in that community so we can provide the most effective culturally and linguistically services to these people, and which we will be moving into the now what we call the Little Saigon District, which is wonderful to know. We will be right in the heart of the Little Saigon District expansion with a new medical and dental center beside the Campo, the 24,000 square feet.
What occurs to me is that as more people get healthy in these neighborhoods, our community is healthier too, and,
yes.
and that's really important.
And we're also promoting the economic stimulus if we move into the community, knowing that not only just the center benefit from it, but also far beyond the center, the community, and so forth.
Well, this is a huge piece of this healthcare puzzle, and we appreciate you being here today to explain it to us.
Yes.
And hopefully that people will take advantage of everything in their community.
Definitely. Thank you so very much.
Appreciate it. Okay, still ahead here on San Diego People. We're going to step back just a bit. We're going to take a global look at the healthcare system and how it compares to what's going on right now in the United States, where we excel and maybe where we're falling behind the rest of the world. We'll be right back. Stay with us.